From CGTN headquarters in Beijing, this is The Hub with Wang Guan.
Hello and welcome to The Hub. I'm Wang Guan in Beijing. It has been 3 years since the World Health Organization declared the outbreak of COVID-19 a public health emergency of international concern. Now the world body has just decided to keep its highest level of alert. And the WHO head warns that it is not time to declare the pandemic over. How will humanity navigate through this transitional period in a safer, more rational way? And what does that mean for China now that the country has optimized its COVID policies? For more on this, I'm joined today in Seoul, South Korea by Dr. Alice Tan, internist at MizMedi Women's Hospital from South Korea. And in Suzhou, China, we have Wu Zhiwei, professor and director at the Center for Public Health Research at the Medical School of Nanjing University. Thank you both so much for joining us at this hour. Dr. Tan, let me go to you first. Some people predicted previously that the meeting at the WHO would actually lower the alert risk, the level of risk of COVID-19, but now the WHO still views the pandemic as a public health emergency of international concern. How do you understand that decision?
Well, thank you first for having me on the program. The WHO, they acknowledge that we are in a much better position now in terms of the pandemic compared to where we were in the past, even compared to last year. However, they did acknowledge that during the last 8 weeks, the number of deaths globally due to COVID-19 numbered more than 170,000. And the potential dangers of taking our foot off the gas pedal, so to speak, are very high. The global risk of COVID-19 to human health remains high. And of course, ongoing transmission levels are high throughout the world. And because the virus continues to evolve and vaccination levels are suboptimal, access to tools also is suboptimal, there are still very many dangers that are posed by COVID-19 in many countries around the world. So I agree that the public health emergency of international concern status is still warranted.
Professor and Director Wu, what do you think? Are you surprised at all that the WHO kept its level of highest alert for COVID-19?
Well, I'm not surprised because basically, if you look at the decision they made, clearly reflects what the real situation in the world. Because first, the medical preparedness in various different regions are very different. In some regions, actually, the therapeutic drugs, the vaccination rates, they are all not very well prepared. So. And also, as Dr. Tan just mentioned, that the transmission rates are very high in some regions. Third aspect is if you look at the death caused by the Omicron, actually, in last year, it reached about 70,000 per week, and sometimes it now went down to about 20,000 per week. But still, you see a fluctuation in the deaths. So that's suggesting that the virus still causes tremendous damage and poses a very serious public health threat to the general population. So I think this is a right decision that we should keep the Omicron or the COVID-19 at the highest level of international concerns.
Right. Dr. Tan, the International Health Regulations Emergency Committee acknowledged that the COVID-19 pandemic is probably at a transition period and that it is not the time to declare it over, of course. How long do you think this transition period can be, and what are the risks in this transitional period?
Well, first of all, in the final stages of a pandemic, the posture should not be relief and forgetting about what to do. The posture is to prepare for the next wave or the next stage. And the virus, as I said, remains unpredictable. So it's very difficult to know how long this transition stage will last. But we do know there are still 33 countries that have very low vaccination rates, so less than 50 vaccine doses per 100 people recorded in 33 countries. There are still countries that we don't have any information about in terms of what's going on with COVID and COVID preparedness, such as North Korea and Turkmenistan. In terms of the biggest risk, Dr. Mike Ryan of the WHO, he mentioned that the biggest risk posed by COVID-19 is the emergence of a new variant or subvariant that puts us back, that resets the pandemic. Those were the words that he used. So if we have a new variant or subvariant that has higher pathogenicity or can evade diagnostics or evade vaccine-induced immunity or infection-induced immunity even more than Omicron has been doing, that could be a huge setback for the entire world.
Yeah, but Dr. Tan, let me ask you, how likely is that scenario whereby a new variant proves to be even more contagious, probably even more lethal?
Well, you know, unfortunately, we're seeing cases of co-infection. So one person can be co-infected with two different strains of COVID-19. One person can be co-infected with COVID-19 and influenza. And so whenever you have people with co-infections, especially if the infections are happening in somebody who has immunosuppression and the infection is long-lived, then there is the risk of recombination events occurring between the two strains of the viruses. And then, of course, you can have a recombination virus. This is not uncommon. And this is actually what's happened with the XBB 1.5 subvariant of Omicron. And so this is something that, this is not science fiction. This is something that we need to prepare for. And in places with high transmission of acute respiratory viruses, not just COVID, but RSV, influenza, and other viruses, you can have co-infection and recombination events.
Yeah, thank you for highlighting and flagging those potential dangers for us and for our audience. Director Wu, what do you think this transitional period is all about? How can people, everyday people, cope with this transitional period?
Well, the danger Dr. Tan just mentioned is a real danger, although the virus itself reverted back into a high pathogenic strains, low probability event, but still we can't rule it out. We have scientific evidence that the virus could generate recombination isolate, which actually is also another potential danger. So, in terms of public in dealing with this virus, I think the common sense is still playing very critical role. Although China, like in our country, we just opened up and eliminate or remove the nucleic acid testing. But I think it's critical that people should be highly vigilant and keep in mind that this is the virus still circulating in the world, and there is still a potential that the virus will bring large number of infections and cause a burden in the healthcare system. So I think it's critical that the good habits we developed during the pandemic should still be observed, such as wearing your face mask and wash your hands, avoid unnecessary large population gathering. Those are the very common practice we have been observed, and we find it's very helpful in preventing large number of infections. So we should keep those good habits.
Yeah, sure. There are many lessons learned throughout this pandemic that has been with us for 3 years, and many are hoping to see the end of the tunnel soon. Dr. Tan, we've seen many countries reaching herd immunity, or where they perceive to be herd immunity through massive infections instead of massive vaccination. How would you compare infection-induced versus vaccine-induced immunity?
Well, the data seem to suggest that people who have hybrid immunity, in other words, immunity from vaccinations plus natural infection, that these people with hybrid immunity have the highest level of protection against future infections and also severe disease and death. But that doesn't mean that we should encourage necessarily infections, because of course infections carry risk of long COVID. And also for the vulnerable groups, infection can lead to severe disease and death. But that's what the data seem to show, that hybrid immunity offers the strongest level of immunity. Also, if people are up to date on their vaccinations, in other words, they've received the third dose or fourth dose or bivalent vaccine, whatever is offered in your country in terms of the most up-to-date vaccination schedule, that having had the third dose or first booster, second booster, that does add to protection.
Hybrid immunity, that is original to many of our viewers. Thank you. And Dr. Wu, how do you look at this infection-induced immunity versus vaccination-induced immunity? What does the research of you and your team tell us about that?
Well, limited clinical data suggests that when you are infected by the virus, you probably would have a stronger cellular-mediated immunity, which actually could provide a better protection and a longer protection in the long run. For the vaccine-induced immunity, one of the problems is that the immune protection wanes very rapidly over the time, such as for the inactivated virus vaccine or mRNA vaccine. If you look at it, after 6 months, its protection capability actually is reduced significantly. So I think, as just Dr. Tan mentions, that the hybrid immunity basically means that there are two types of different vaccines, either infections or different vaccines, would give a much better protection. I think this is one of the key issues or the point that we are promoting in the fourth booster shots, that we should use different the vaccines with different manufactured technologies.
Right. Advice heeded. Thank you. And Dr. Tan, you talk about the fact that there can be long COVID, right? To begin with, people think that this is just fear-mongering. But as time goes by, many people feel that even if they recovered from COVID, their symptoms, such as oftentimes they're short of breath, they feel tired often, there's fatigue in their body. How real is the danger of having long COVID?
Long COVID is real. It can be subtle. But this is an area that requires a lot more research. We need research in terms of determining why people have long COVID. So what is the genetic mechanism behind long COVID? We need research behind how do we best deal with long COVID. There are so many unanswered questions. And so I think there's a lot of room for centers around the world. For example, in China, Wuhan, I think the universities and medical centers there, they are doing research on long COVID, but there's a lot of room for supporting research in medical centers around the world. I think we also need to pay attention with what's going on in centers of excellence for long COVID care. For example, Mount Sinai Medical Center in New York, they have a center for post-acute COVID care. And so we can learn from each other and try to help our populations as best as possible in terms of dealing with long COVID, because it is definitely real. We can't deny it, and it's not helpful to deny it. We need to do more research and to help the people who are suffering.
Yeah, what about the cases, the infections in South Korea, your country? Tell us about long COVID.
So fortunately in Korea, we had a relatively high vaccination rate before we went into our Omicron wave. And we do know that vaccination does seem to mitigate or decrease your risk of developing long COVID. But we do have cases of people who are complaining, as you mentioned, of long-term fatigue, shortness of breath. In the US, they are finding that people have increased risk of diabetes, blood clots, strokes, cardiac conditions. But in every case, of course, we find that in terms of preventing long COVID, vaccination does seem to help. Also, using antiviral medication may help in terms of preventing long COVID. And getting people into research, clinical trials, I think is very important. One problematic area is people can have symptoms, and because there are so many unanswered questions, many people are engaging in experimental treatments without, not in the context of a clinical trial. And that, of course, can be very, very dangerous. And people can advertise false hopes of unproven treatments. So I think that's something that governments need to be on the lookout for and make sure people don't fall into traps.
Yeah, there's so much misinformation and disinformation out there. It's advised, highly advised to seek your, go to a doctor before you go online and seek those advices from what we call barefoot doctors. Dr. Wu, what about your experience in China? Because in China, when many people got infected, chances are they feel that there's shortness of breath, they have other symptoms. So what about the cases in China tell us about long COVID?
Well, we still do not have systemic studies on the long COVID, and also the so-called long COVID study. Basically, the definition also is vague. But I agree that as we see more and more patients, it's clear that long COVID is a reality. This is something definitely we need to do a lot of studies and address some unanswered questions. The issue here is that, right now, such as in the Nanjing University, the medical schools, affiliated hospitals, we do have such patients that it's not very clear whether certain symptoms are directly caused by a COVID-19 infection, or whether it's actually complicated by some underlying medical conditions because of the infection. So it's a complex issue. We need to do a lot longer studies and basically longitudinal studies to follow up to see what actually is the ultimate outcome, or how they were related to the COVID-19 infection. So this is a more kind of a scientific and clinical issue we need to pay attention to.
Yeah, also, Dr. Wu, Dr. Tedros at the WHO made a reference to mistrust. He said any public trust in the safe and effective tools for controlling COVID-19 is being undermined by a continuous torrent of mis and disinformation. What do you understand by that? Where is this continuous torrent of mis and disinformation coming from?
Well, actually, I think this mis and disinformation basically you can see from two sources. One is that if you open internet and key in information such as COVID-19 vaccine, and you will get all sorts of information popped up, and such as vaccine safety, and you get all sorts of information from the website. A lot of those informations are either misinformation or disinformation. It's no question that you will get dozens of all sorts of feedbacks. So those are the basically in the internet. One of the problem is that the COVID-19 vaccine side effect actually could be quickly, such posts will be transferred and amplified by certain communities. So this is one of the big issues when people are actually looking at such as for the vaccines safeties, they could quickly get a wrong information, and that's why many people are scared of taking vaccines. I actually often getting inquiry whether the vaccines are safe for certain elderly people or people who actually have certain underlying medical conditions, and a lot of those questions actually should be reflect a certain kind of mis or disinformation. The other source of this misinformation is coming from politicians, particularly in the early stage of the COVID-19 pandemic. And basically, this is different sections of political forces actually utilize this pandemic as a tool to attack each other. I think this is one of the issues that this kind of a political fighting basically proliferate into the medical and the societal level. So that's why it's very hard sometimes to get the right information penetrating into the general population.
Yeah, no more politicization, especially when it comes to treatment, vaccination, things related to public health. Dr. Tan, you talked about the fact that vaccination and improved diagnostics can all help improve the battle against the virus, but the WHO says, and I quote, that the global response to COVID-19 remains challenged because in too many countries, these powerful life-saving tools are still not getting to the population that need them the most. As a medical professional, what is the right thing to do at this point?
I think we do need to look at the global landscape in terms of, as you're mentioning, the access to countermeasures and tools, vaccines, diagnostics. Also, it's very important to make sure that we have a surveillance network globally in place that is working, that we perform exercises periodically to make sure that we are catching signals in a timely way. And I think what we need to do is take a totally different sort of mindset that this is not a national problem. This is a global problem. We really need to increase our concern and awareness in terms of what's going on in people who live far away from us. And it really is, I think, a matter of increasing empathy and awareness for what's going on around the world. So many of the countries that are in the middle and low income brackets, they are the ones that will suffer from the long tail of this pandemic the most because of lack of access to diagnostics and vaccines and countermeasures. And this is simply unacceptable. And we need to get the leadership and also public support for making sure that this kind of humanitarian crisis does not happen in our day and age.
Yeah, exactly. Well, if the pandemic has taught us anything, that is we're all in this together, definitely. Professor Wu, Europe and countries like Japan and the United States have all experienced multiple waves of COVID. What can China learn from their experience, and if any, what can they learn from China?
Well, I think it's very critical that in the early stage, what we learned is that we need to have a very strong government, particularly in the case that when we do not know much about the virus, about the pandemic. So a strong government and coordinated societal forces actually are very critical in dealing with a large-scale public health crisis like COVID-19. The second is that I think what we learned is that since it's a pandemic, various different governmental coordination, cooperation, and put aside the political differences are very critical too. And the third is that we need to enhance the role of the WHO, which actually is one of the very important forces in dealing with the global public health crisis. Those are the few things we learned from the COVID-19 pandemic. The other thing, as China, getting into the fourth year of the pandemic, what we can see is that our initial reaction or our initial measures against this virus actually is quite effective. As the virus evolves, actually we need to build up a very strong surveillance and also the medical intervention approach. Those are the issues actually I think it's playing a very critical role. The other thing actually as a medical research professional, I feel that we need to build up a very strong research background, research base to develop effective vaccines and therapeutic drugs. And this is something actually I think the Western developed countries has a strong hand. That's what we need to learn. We need to do a long investment and build up such capacity.
Yeah, Professor Wu, we know that more than 65% of Chinese population now live in urban areas. How do you think China's mega cities can achieve their development goals, their GDP goals on one hand, to make sure there's enough income, there's enough jobs, while at the same time ensure that residents are protected against long COVID or against another potential wave?
Well, in the large city, if you look at that since the early December, when we open up the society, the COVID-19 cases reached the peak at the end of last year, the end of December, and in January, we can see that the overall infection and severe cases in the hospitalization actually down to very low levels. So in the big city, I can feel that the life pretty much come back to normal. I have been traveling around for the past 2 weeks, and you can see in different cities the life is pretty much normal. But in the countryside, the situation is probably different because our medical health care facilities are very much concentrated in big cities. In the rural areas, those the healthcare system should be further enhanced. Particularly, I think one thing we need to do is that we need to provide, stock up a sufficient vaccines, therapeutic drugs in the base level hospitals and in the county level healthcare facilities, in case that one certain outburst of the COVID-19 happen in those areas, then people in the rural areas can all able to respond quickly and control the outburst to a smallest scale. So I think those are the things actually it's very critical for us to come back into normal, to bring the economic activity back into the normal.
Yeah, a lot of the older generation, the senior citizens live in the countryside, and it is absolutely crucial that they are protected. Dr. Tan, on Monday, the International Federation of the Red Cross and Red Crescent Societies warned that all countries remain dangerously unprepared for future outbreaks. Some officials also said that the pandemic should be, quote unquote, a wake-up call. What do you think the experience of COVID has taught us, and how close are we to maybe another pandemic, and by then, how shall we deal with it?
Right. Well, climate change is another challenge that affects the entire world, and climate change and extreme weather events, they will increase the risk of the next pandemic, emerging pathogens. I do agree that the world remains unprepared for the next pandemic. What we need to do is make sure we bolster surveillance, not just among human populations, but also in the environment and in the animal populations for emerging pathogens. We need to have a surveillance network that is, as the WHO said, tied into our global influenza surveillance network, which generally works very well. We need to make sure that we perform exercises, not just within the scientific community in terms of making vaccines for the next pathogen in a timely way, making diagnostics quickly, scaling up vaccines, diagnostics, and therapeutics for the next pandemic. But also, I think we need to make sure that our social sciences, so the soft sciences, are also bolstered and exercised. What I mean is, so much of the pandemic was accelerated and expanded because of poor communication and a misunderstanding in terms of human behavior. And so I think we do need to incorporate the social sciences more into our pandemic response, build capacity, and have preparedness and resilience part of our priority in terms of how governments budget their plans going forward.
Yeah.
We can't have financing go into
exactly.
panic.
Dr. Tan,
and
I'm afraid that's all the time we have for this
cycle.
live program.
We can't let it
Thank
happen.
you so much for your advice. We learned so much. And Professor Wu, thank you. That will do it for this edition of The Hub. I'm Wang Guan in Beijing.